Next paper is on predictive accuracy of Barrett's TK TORIC calculator compared to measured PCA using pentacam by Dr. Ashlyn James Joseph.
Good afternoon to all. I'll be talking on a study on the predictive accuracy of Barrett TK TORIC calculator compared to the measured posterior corneal astigmatism using pentacam in TORIC IOL power calculation. I am Dr. Ashlyn James Joseph and my co-author is Dr. Tamilarisi S. ma'am. I have no financial disclosures. So cataract surgery has now become more of a refractive surgery, and the aim is to achieve post-operative emmetropia and spectacle independence. More than 40% of the Indian population has high levels of corneal astigmatism at the time of cataract surgery. So it should be dealt with. In the past, posterior corneal astigmatism was ignored. This led, it has a value of 0.3 diopter against rule astigmatism. So it can lead to overcorrection in eyes with the rule astigmatism and undercorrection in eyes with against rule astigmatism. Douglas Scott said that posterior corneal astigmatism should be taken into consideration while calculating the total corneal astigmatism. Total keratometry is a new keratometry value that is incorporated in the IOL Master 700. It uses telecentric 3-zone keratometry and a swept-tooth OCT to measure the total corneal astigmatism. The pentacam uses a rotating stream flow camera to measure the anterior and posterior corneal surfaces, and this data obtained can be used in standard toric IOL calculation. The aim of the study was to compare the predictive accuracy of Barrett TK toric calculator to measured PCA using pentacam in toric IOL power calculation. The primary objective was to compare these two methods to the Alcon online toric calculator, which has the Barrett toric calculator incorporated in terms of the mean absolute prediction error, and this was calculated as a difference between the actual post-op refractive astigmatism and the predicted refractive astigmatism. The secondary objectives were to find the magnitude of preoperative corneal and postoperative refractive astigmatism and to find the percentage of eyes with prediction error less than or equal to 0.25, 0.5, 0.75 and 1 diopter. The study was conducted at Eye Foundation Hospital, Coimbatore. It was a prospective comparative study done between September 2019 to May 2021, and the duration of follow-up was for 6 weeks. The inclusion criteria included patients above 18 years with age-related cataract who had regular corneal astigmatism above 0.75 diopter, willing for regular follow-up. Exclusion criteria: any pathology which might preclude accurate manifest refraction, case of post-op toric IOL misalignment, small pupils or resurgeries were excluded from the study. The sample size was calculated as 118. Pre-op evaluation included history and all other routine investigations. Toric IOL power calculation was done using 3 methods. The IOL selected for the study was Accuracy of IQ, which is having aspheric hydrophobic material and has a good rotational stability. So the calculation was done using the online toric calculator. This was done routinely in an institute, and the IOL power with the least residual refractive astigmatism was selected and the value was noted. The value of residual refractive astigmatism from the Barrett TK toric calculator was also noted. Pentacam evaluation was done and values of the posterior cornea were noted. And then we used the online Barrett toric calculator. Values from the IOL master were entered, and then we select measured PCA instead of the predicted PCA, and we enter those values from the posterior cornea of pentacam, and we calculate to get the total value. And here we note the value of the refractive astigmatism. And IOL implantation was done under Virion guidance. So the results, 90 patients were included in the study. It was done unilaterally in 62 eyes and bilaterally in 28 eyes. 54% was OD and 45% was OS. Majority of the eyes, patients were in the 60 to 69 years age group, and majority were males. Most of the patients had against rule astigmatism of a magnitude between 1 to 2 diopter. The mean keratometry value was 1.46 and the mean IOL power was 20.78. Post-op refractive astigmatism was less than 0.5 in majority of the patients, more than 85% of the patients. And comparing the 0.25, 0.5, 0.75 group, it's similar in all the 3 calculators. Repeated measures ANOVA was done between the 3 calculators and it was not significant. And post-hoc Montferny assessment is also done between the calculators and it is insignificant. Similar results were obtained in the against rule astigmatism group, with the rule astigmatism group and oblique astigmatism group. And compared to previous studies, the results were similar. The limitations was different IOL models should have been studied, and we should have compared other industry toric calculators also. And we should have done direct measurements in unconventional cases like post-LASIK cases. So conclusion is posterior column astigmatism should be taken into account in toric IOL power calculation. The Barrett TK toric calculator and measured posterior column astigmatism of pentacam has similar predictive accuracy to the online toric calculator, and since it is not outperforming, we can continue using the predicted posterior column astigmatism till we develop a technology that will supersede this. And the Barrett TK toric and the updated Barrett toric calculator might give a better predictive accuracy in post-refractive surgery eyes, and these need to be studied. These are my references. Thank you all.
What was the SIA used?
We used 0.1, sir. Previously,
Was it calculated?
Previously, we have done studies in our institute, and routinely we are
This
using
was
0.1.
for the particular surgeon. They say this was a
Yes,
single
for
surgeon
the surgeon.
cases.
Yes, sir.
So for that surgeon, you have calculated SIA.
As 0.1. Previously, they have calculated, sir. So we
0.1 for 2.2 millimeter incision or 2
Yes,
millimeter.
sir.
Okay.
Yes, sir.
All cases were done by single surgeon.
Single surgeon, sir.
Okay.
We had 1.5 year time was there, sir.
Okay.